Guys, welcome back to Medical Coding with Blue. Today's episode is all about why you can study for 20 hours per week for medical coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, last month we talked about this and I put up 3 templates and I'm going to go over these templates again today. But these 3 templates that I created for studying 20 hours per week when you're studying for medical billing and coding. Okay, guys? Now, I know what a lot of you are saying. Blue, no, I have a 40-hour-a-week job. I got family. I've got kids. I'm doing everything all by myself. And I don't have 20 hours a week to study. If you want to be a medical coder and pass that certification exam, you need to make the time. There is no excuse. So you don't have to justify to me why you think you can't. Okay, there's plenty of people who write into my channel who have plenty on their plate and they still manage to make 20 hours per week to study. And it wasn't all just cramming it all in one day. It wasn't all just neglecting their family and not being around. They actually had time to spend with their family because you learn how to delegate your time and you learn how to make sure that you are able to have time for yourself and your family. So walking through these again today, we're going to talk about how it is possible. And even if you work at home, and let's just say that you don't have the commute, you still have time in between time in order to fit some study time in, okay? Now, study time can be in the form of a lot of different ways. It's not just working out of a book. Study time can be listening. Study time can be watching videos. So there's just a bunch of different ways to get that information in. And a lot of times we have to think back to how we learned when we were children. The teacher put up the posters all around the room with the numbers and the letters so that we constantly had that stimulus. It's the same thing when you are studying for medical billing and coding and you're in your study space. You have to have those things up to help you, whether it's the anatomy posters, whether it is medical terminology, or whether it is just prefixes, suffixes, or root words that you hang up and you have like in a list of 10 and you leave it there where you can see it every day. And so, okay, for a whole week, and then you switch the paper and you go with another 10. So that way you constantly have that stimulus around you and you can see that there's just these different prefixes, suffixes, and root words, and knowing those will help you to learn to piece words together for medical terminology so that it's not so hard, okay? So that's just something that you have to know, guys. You're able to make time for it because people make time for things that matter to them, all right? Now, the way that these study schedules are set up, and I will leave them in the community tab. I will also repost this again on Instagram. I'm on Instagram, Medical Coding with Blue. But I will leave them there so that way you can take them, you can use this as a template. Now, you don't necessarily have to follow the exact time because sometimes people have just different work schedules, but the idea and the concept are there, okay? So I'm going to start out with the first one, okay? So this first study schedule will get you to 20 hours in a week, right? In this time. But during the weekdays, Monday through Friday, right? You're studying for 3.5 hours per day. 3.5, okay? So let's just say, for example, and again, you fit this to however is best for your schedule. But I will say before I start, don't study for more than 1 hour at a time. If you think that you're going to cram 8 hours in a Saturday, 8 hours in a Sunday, and I got 16 hours and all I have to do, you're going to burn out. You're going to burn out and none of that is going to stick in your head. None of the concepts, none of the getting through the book and practicing, none of it's going to stick if you do not take the time to break it down into manageable pieces. Because remember, we're adults, and adults have different things on their mind versus when we were children and we didn't have a car note, a house note, or any of those things. And we had to just sort of, okay, all our job was when we were kids was to study and go to school, and that was it, and play sports. And now it's not that way. We have everything else. So we have to work with that, okay? So this first one involves 3 half-hour sessions and then 2 one-hour sessions. So the 3 half-hour sessions, one begins at 7 to 7:30, that's 30 minutes. 11 to 11:30, that's another 30 minutes. 4 to 4:30, that's another 30 minutes. That's already an hour and a half, okay? Now, there's a break in between because you don't pick back up again until 7 o'clock to 8 o'clock. That's 1 hour. 7 to 8 is 1 hour. And then you have from 8:30 to 9:30, that's another hour. So that's 3.5 hours that you've studied in one day. Now imagine doing the 3.5 hours in one day times 5. That's 17.5 hours you've already studied for the week. 17.5 hours you've already studied. Now, all you need to study on Saturday or Sunday is 2.5 hours, and that is it. That's it. You've hit your 20 hours per week. You have the whole day Saturday and the whole day on Sunday to spend with your family or lay in bed or do whatever you do. But on a Saturday or Sunday, 10 o'clock to 11 o'clock is 1 hour. 1 o'clock to 2 o'clock is another hour. 2:30 to 3 is a half an hour. And there you go. And like I said, you don't have to go specifically with these hours. You can go with whatever time works best for you. If you are an early bird, by all means, get up early and do your thing. If you are a night owl, then by all means, make sure that you set yourself up for success at night. Get your rest when you can, okay? So none of these go past 1 hour, okay? Don't go past an hour because you're going to burn out if you do, okay? So that's how you get to 20 hours. And that's a fantastic way to hit 20 hours. That's very easy. And it's doable for any schedule. It's doable for anybody who is working even a full 40-hour week job. And if you say, well, Blue, I'm tired and I don't want to do this, you're the one who chose this. This is what it's going to take to be successful in this field. So that way you get the practice, you get the study time in, because there's, again, no amount of money that is going to set you up for success other than good old fashioned sweat and really working with these books, okay? So this next schedule is 20 hours. You're only studying during the week, right? Monday through Friday, but the weekends are off. You have no study on the weekends. This means that you can have the full time for your family or your friends or whoever, right? So the 4 hours, and this is for somebody who has time during the week, all right? Really has a lot of time during the week. Maybe works a part-time job or something like that. And this could really fit for somebody in that situation. But 10 to 11 is 1 hour. 1 to 2 is another hour. 6 to 7 is another hour. And 8 to 9 is 1 hour. That's 4 hours per day, 5 days. That's 20 hours. It's that simple, guys. Literally that simple. If those hours don't work for you, again, pick something else that does. You can listen to things while you're cooking. You can listen to things while you're washing dishes or taking the kids a bath or doing whatever it is that you got to do. Make the time. Make the time. Don't make excuses. Make time. And please, whatever you do, don't write me and tell me your excuses, because guys, I'm not going to respond. I'm not. Because to me, I've heard everything. I've heard every reason under the sun why people don't study. And then it's those same people that complain that they can't pass a test. And then they want to blame anxiety. And they say, okay, well, no, I'm anxious. That's why I can't. No, you're going to be confident walking into that room because you've spent 80 hours in a month studying. And, by the time you get to your exam time, you spend 240 hours studying, right? 3 months, 80 hours times 3, 240 hours. And you've spent all that time studying. You're going to be prepared and ready because you've worked through these books. You've flipped through them. You've practiced with them. You're not sitting here marking them up, tabbing them up, circling, doing all that other nonsense, because if you're using your manuals like you're supposed to, it's going to have the answers. It does not need you to add anything to it. All right? I'm just saying. Now this other schedule, this is going 5 hours a day for 4 days. Now, hear me carefully when I say this one. You got to be careful. This is for the advanced student, all right? For the advanced student that can really buckle down and focus on what they're doing. If this is not you, be realistic and go with one of the first two, all right? But for this one will allow you to rotate days off, right? You can have 2 days off, you can have a day off in between. I don't really recommend going longer than 2 days off when you're studying, because if you're going 3 or 4 days and then all of a sudden you try to come back to it, there's a good chance it's not going to retain as easily as if you were just studying a day, take a day off, get back to study, and then take another day off, and then maybe another day, and then get back to study, okay? It's a little bit easier that way in order to hit it, rather than trying to space it out so far in between, okay? So the schedule goes 9 to 10 is 1 hour, 10:30 to 11 is a half an hour, 1 o'clock to 2 o'clock is 1 hour, 2:30 to 3 is a half an hour, 4 to 5 is another hour, 6 to 7 is another hour. That's 5 hours right there. And it's a total of 20 hours in 4 days. Okay, so again, you can take a day off in between. No more than 2 days off, really, guys, because it's just going to throw everything off if you take longer than that off, all right? And if you happen to falter, let's just say, well, you say, well, Blue, I was just so busy and there was just all of these things that happened during the week and everything. It's not a reason to give up, guys. It's just a reason, okay, this week was just really busy. Let me reset and let me go back to my study schedule. It's not a reason, just because you have 1 week that's kind of all over the place, it's not a reason to stop studying. It's not a reason to lose that commitment to your studies and making sure that you stay disciplined, because really a lot of this is about discipline, and discipline is very, very lacking in adults and in children nowadays, because with children it's just like everything is about the tablet or the computer. They're not outside, they're not using their imagination, they're not doing all these things because everything is now. And it's the same thing with adults, right? Adults have this now attitude. They want everything right now. They don't want to spend the time to have to learn all of this stuff. They get frustrated having to learn medical terminology and anatomy. Then they get frustrated with the guidelines and, oh, they're so boring. Not everything is meant to entertain you, right? Not everything is meant to entertain you. And if that's your attitude and if that's your mentality about it, then you should really rethink getting into this field, because it doesn't get any easier. It gets harder every time. The rules change, the guidelines update. There's more and more things to learn. There's new equipment that comes out that's going to require you to really kind of understand the nuances and everything about this industry. And that's something that you have to truly be committed in order to do it, right? But the more that I hear people say, I can't, then what are you doing? What are you really waiting for, right? What is it that you're waiting for, that for somebody to come and rescue you? And what, you don't do your part, right? You don't do your part, you don't study, and you just say that, oh, well, I can't pass it because I had poor teaching, I had, too little time, I had this, I had that. We have the ability to be able to teach ourselves this field, because you can learn it from a book. There's a lot of people that say, oh no, Blue, I can't learn from a book. Okay, if you can't learn from a book, then you can incorporate other things. The great thing about YouTube is that it has a lot of channels about medical terminology, about anatomy. There's even a HIPAA channel, guys. There's a HIPAA channel that goes over all the stuff about HIPAA. Don't ask me what the channel is, because when I've recommended channels before, I get a lot of people hemming and hawing, so I'm going to keep that to a minimum, because I get people who hem and haw about other things all the time. And I'm not about to add that for YouTube as well. So if you want to find them, all you have to do is let your fingers do the walking in YouTube, all right? And you'll see a ton of them pop up, okay? So I'm not in the business of recommending other things right now, because, again, you can do that research. This is, again, teaching you to fish and not just giving you the fish. All right. If you've never heard the expression says, if you give a man a fish, you feed him for a day. But if you teach a man to fish, you feed him for a lifetime. That's exactly what I'm trying to get through to you all, is that the study times and the materials and all the things that are available now to help you to study, those are things that you really need to work with so that you can continue to build your knowledge. It's not going to come to you overnight, and certainly you should not expect it to. If you've got into a really fast-paced medical coding program, there's things that can be done about it now. You can use the independent study syllabus that I leave in the description box. I leave the link to that video in the description box. You can go to it. You can look at the breakdown of all of the months and everything that you should study per subject. And it's just a recommendation. Certainly, if you have a strong anatomy and medical terminology background, you don't have to go over those things again. But should you need a refresher, there's those books that I recommend there as well. All right. But practice, practice, practice. The American Hospital Association ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by Nellie Leon Chizen is the #1 book that I recommend if you are trying to learn diagnosis coding or if you are trying to learn the inpatient procedure coding, ICD-10-PCS. For the CPT side, I recommend the CPC Study Guide. You can get the 2019 version. You can also get the 2020, 2021, or 2022, or you can even get the 2023 edition. However, I will say this. The 2023 edition is going to be the most expensive because we are in 2023. If you get the one from the year before, it's going to have the same exact questions. And there may be some code updates, but it's not going to be the entire book that's going to be updated. All right. So you can still get the same book that I recommend. You can get a newer version if you wish, whatever you want to. But by all means, just start. Quit making excuses. Stop saying that, oh, I can't do this and I can't do that. Why don't you lead with what you can do? What can you do? When can you make the time? And for those of you who sit there on TikTok and LinkedIn and Instagram and all those other ones, and you don't think that time adds up, with TikTok, and I don't believe in TikTok, guys. I don't. That's why you won't catch me on there, okay? Because I think that contributes to the short attention span that a lot of adults have because they want these little 7-second clips. Oh, why don't you get on TikTok? No, ma'am, no, sir. I don't think so. Because if anybody who really wants to take medical coding seriously can find my channel and they can watch my videos, because that's what I do. I take it seriously. I'm not about this TikTok thing where, people are just sitting there scrolling. And by the time you know it, an hour has gone by and then another hour. And these are the same people who will tell me with a straight face, I don't have time. Okay. I'm just saying, guys. So, and it's not forever. This intensive study is not forever. Please keep that in mind. This is just for the beginning. This is just to get you to your exam. And this is just to get you to pass. And once you've passed, yes, you still need to study. Obviously not as intensive. You can go down to 10 hours after that. You certainly don't have to stick with the 20 hours. But the more you do study and the more that you practice, the more that it will help you. And all you need is those workbooks, guys. You don't need a bunch of fancy things. You don't need boot camps. You don't need none of that. You just need time to be with the book and time to sit there and look up codes in the book, right? I just posted some exercises for my Patreons, and Patreon, if you don't know, is a lot like YouTube. There I post lots of coding quizzes. I post crossword puzzles and word finds and things like that to kind of keep your brain stimulated on those medical terminology things. I do a lot of what is this code, what is this code, what is this code, because of the simple fact that I don't push out a lot of those big op notes, because of the simple fact that if you're wanting those big op notes and you say, well, Blue, I want practice scenarios and I want practice op notes and things like that, how do you know what diagnosis to look at if you haven't been practicing looking up diagnosis? and seeing diagnoses listed out. How do you know? Because when you get all of these words in front of you, it's going to be like, okay, what do I do? What do I pick up? But if you've been practicing with these diagnoses and procedures to look up, then you're going to recognize, oh, well, this says it's a laparoscopic appendectomy, or oh, this patient is here for a knee replacement. So I'm going to know, oh yeah, I got to put the when they're in the aftercare, that they're going to have that replacement of a joint, and then you're going to have to code for the joint. So it's just practicing and getting yourself conditioned that way. And that's what I do for my Patreons. I don't do it here anymore because when I used to do Quiz Friday, people started to complain about it, and okay, don't want to be grateful about it. That's fine. I'll leave it for my Patreons then. And ever since then, that's what I've been doing. And it's a sad thing because I really like to teach. I like to do those things, but okay. So that's why I do it for my Patreons. But that's my message for today, guys. You can make it happen. Stop making excuses, guys. Just make it happen. And quit all the things with the people and, oh, they said and this person did this. No. A lot of times they don't know about medical coding anyway. And I'm a veteran medical coder, and I'm telling you, this is what it takes to be successful. And how do you build your knowledge? Well, you build it with time. And this is how you get there. It's not always the most comfortable, but it is the way that it has to be. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.